Plant-Based Business Hour is an awesome vegans podcast series. In these special Corona times, you can find me every weekday at 1 p.m. right here live on Jane Unchained. I've started this series not just because we need more content right now, but because I'm concerned that the right kind of content isn't out there. I'm concerned that perhaps people aren't making the connection between eating meat and the Corona pandemic that we have now. So I want to give a platform to the business leaders and the medical leaders in our society who are giving us a safer future. And that means plant-based meats and whole food plant-based diets, and turning our healthcare system into something that hopefully supports health and not sickness. So this is a show for both consumers and investors, as I do believe that we are part of not just the largest social justice movement of our time, but also the largest business innovation movement of our time. With that, I want to get to my first guest because we are short on time with him. He is in such high demand. Dr. Dean Ornish joins me today on the Plant-Based Business Hour. Dr. Dean Ornish, thanks for being with me.
Oh, it's a great pleasure. Thank you for having me.
Okay, so I hope I don't embarrass you, but your list of accomplishments is so long that I'm just going to go ahead and read them. Is that okay with you?
Okay.
Here we go, everybody. Take note. It's quite impressive. Dr. Dean Ornish is a practicing physician and the president and founder of the Preventative Medicine Research Institute in Sausalito, California. He is a clinical professor of medicine at the University of California, and he's the author, and probably for how we know him best, of Dr. Dean Ornish's program for reversing heart disease, Eat More, Weigh Less, The Spectrum, and his current book, Undo It. Of course, we know him as a lifestyle medicine doctor intent on reversing disease, and we thank him for that. In 2011, Barack Obama appointed him to the Advisory Group on Prevention, Health Promotion, and Integrative and Public Health. And of course, he was the physician's consultant to President Clinton. I told you this was a great list of things. He was also chosen as one of the Time 100 Integrative Medicine specialists. He was recognized by Life magazine as one of the 50 most influential members of his generation, and he was selected by Forbes as one of the 7 most powerful teachers in the world. Again, Dr. Ornish, thank you for being with me.
Thank you for having me.
So I'm going to get right into it. How are hospitals coping with these crazy coronavirus times? I worry that maybe there are backlogs, there are bottlenecks, there aren't enough beds, there aren't enough masks. What are you seeing on the forefront yourself?
Well, I think that's what everyone's most concerned about, is that the demand for services will outstrip the supply, particularly for life-saving devices like ventilators and so on. And so I think that it's really important that people listen to the public health experts who are advising us to self-isolate in order to flatten the curve and to keep from overwhelming the system. But that's half the equation, and it's important to all the things that we've heard over and over again, to avoid getting too close to other people, stay at home as much as you can, use hand sanitizers, wash your hands frequently, wear masks and gloves if you have to be around other people, and so on. But there's another half of the equation that really not much attention has been given to. I wrote an article about that recently, which is that not only do we want to prevent exposure to the virus, but very little has been written about how we can enhance our immune system so that if we do get exposed to the virus, we can reduce the likelihood of it causing us to get sick. And we know that the virus lives on cardboard and things like that for a day or two at a time. So if you get your packages delivered to you, and you bring them into the house, there's always the chance that you might still get exposed to it. So as much as we try to avoid exposure, and I think we need to do is everything we can in order to do that, inevitably some people will get exposed. And that's where our own immune system can play an important role. We don't get as influenced by the influenza. And for the last 42 years, I've directed a series of studies showing that simple lifestyle changes can reverse and therefore prevent the progression of a wide variety of chronic diseases. We showed for the first time that even severe heart disease could actually be reversed. Type 2 diabetes, high blood pressure, high cholesterol, early stage prostate cancer. That when you change your lifestyle, it changes your genes and turns on the good genes, turns off the bad genes. When you change your lifestyle, it can reverse aging at a cellular level by lengthening telomeres. We're in the middle of the first randomized trial now to see if these same lifestyle changes may reverse the progression of early stage Alzheimer's disease. And the more diseases we study, the more evidence we have of how powerful these simple changes can be and how quickly people can often get better in ways that we can measure. We don't know yet about the Alzheimer's study, but these other things we've actually proven and published. And in my new book called Undo It, my wife and I present a new unifying theory that these are really the same disease manifesting in different forms because they all share the same underlying biological mechanisms. And one of which is immune function. And we know that our lifestyle choices affect our immunity for better and for worse. I mean, for example, it's important to stay home, but the social isolation itself can create problems. Study after study, for example, have shown that people who are lonely and depressed are 3 to 10 times more likely to get sick and die prematurely from virtually all causes when compared to those who have a sense of love and connection and community. And so it's important to maintain the social isolation in terms of, living it away from other people, but to reach out in virtual ways like you and I are doing now, a phone call and so on from a friend. And one of the most dramatic examples of that was a study that was published in the Journal of the American Medical Association several years ago by Dr. Sheldon Cohen. And he did a study, I don't know how he got this through the Human Studies Committee, where he actually dripped rhinovirus and coronavirus, a different variant of the one that's epidemic now, but into volunteers' noses. I mean, you couldn't pay me enough to be in that study.
No, me neither.
And 100% of them got infected, but not everybody who got infected developed the signs and symptoms of a cold. And what they found was those that had 6 or more what they called social ties, a visit from a friend, a phone call from a friend, a Zoom from a friend, compared to those who had 3 or fewer. Those that had 6 or more were more than 4 times less likely to get sick, even though all of these people were infected, not all of them got sick. And those that had the most social interactions in terms of not being with people in person, but by phone and by other kinds of things, that they had that sense of connection and community, were 4 times less likely to actually develop the signs and symptoms of a cold, even though 100% of them were affected. And other studies have shown that emotional stress can lower your defenses. And when you're depressed, your immune system is depressed. One study that was done at UCSF, where I'm a professor, by Margaret Chesney and her colleagues, found that men and women who were HIV positive, who were depressed, were more than twice as likely to go on and develop AIDS and die from it than those that weren't. So these are things that really can make a big difference in our lives. Eating well can make a big difference. A whole foods plant-based diet that's low in fat and sugar, as you've talked about on your show many times, can enhance your immune function. Moving more, exercising, just walking, get out of the house and walk around, avoid other people, but, just walk around outside, get some vitamin D from the sun and move a little bit. So, when we can eat well, move more, stress less, and love more, it can help boost our immunity and reduce the likelihood that we're going to. This doesn't mean you should go out and deliberately expose yourself to other people, but sometimes it's impossible to avoid all of the viruses. But how our body interacts with that is something that we have more control over than we might have realized.
It's an interesting time when we all almost have to think like an athlete. You want that competitive advantage so that if you do get sick, you are in the best shape of your life, meaning getting exercise, as you say, all of this in your book, Undo It, getting exercise, socializing to the extent that you can, a whole foods plant-based diet, and keeping down the sugars. Can I go back to what my mama used to always say, which is in times of trouble, vitamin C, vitamin C, vitamin C. Is that accurate?
Well, there are several supplements that I think that people are finding may have some benefit. Vitamin C is one that's actually been shown to have some benefit with the coronavirus. I think, just a good multivitamin. There was an article in the New York Times yesterday that was questioning whether people should be taking supplements at all. But I think that they can, properly used, they don't substitute for a healthy way of eating. I know that the soft drink manufacturers at one point were talking about putting vitamins in their soft drinks. That's not the right idea. But in combination with the other things we're talking about, I think they can be valuable.
But even through foods, for example, should we be paying extra attention to, say, berries with lots of antioxidants? Or there's a juice that I'll share with everybody because I sure do love it. I juice 6 carrots, 1 large lemon, 1 red bell pepper, and then I add a little turmeric, and it's like drinking sunshine. And of course, it's this boost of vitamin C. Are these things sort of too little, too late, or can you be beefing up on certain foods?
Well, beefing up may not be the right metaphor, but
it is not.
But yes, I think it's never too late to begin making changes, even if you have the coronavirus. I think that
Yeah.
whether this becomes a mild case or a severe case, in part is a function of how robust your immune system is. And these are things that we can enhance when we eat well, move more, stress less, love more, take certain supplements. These are all things that can make a difference. They're not. It's not this or that. It's doing everything that can make you more healthy and more robust. And the kinds of things that you're talking about are, I think, good for people to do year round.
Mm-hmm. Let me ask you, from your medical opinion, they've been throwing out, they being Donald Trump, to the mayor of Los Angeles. So across the country, you've heard maybe we'll be back in swing by April, mid-April, and others are saying not until summer or even early fall. I'm wondering if you have any comment for us in terms of timeline.
I think it would be really unfortunate if people started going back to work, in just a few weeks, because that's when, the cases are still doubling exponentially every few days. I think what's happening in New York City is an unfortunate harbinger of what may happen through the rest of the country. The big issue is that we don't want to overwhelm the healthcare system to the point where there aren't enough ventilators to go around. There are not enough ICU beds to go around, so that people are dying who could avoid that if we had more resources. Now, one can certainly argue that this was not a surprise. We knew back in January they were actually doing various emergency planning for what might happen, different scenarios, different ways of what should we do. So unfortunately, we didn't act soon enough as a country. We could have done a lot more to contain this earlier on, when people were minimizing it, when they should have been really paying attention. But here we are. And so I think that now that we're here, and now that we see how these cases are in New York already overwhelming the healthcare system,
Yes.
and that's likely to occur throughout the country, I think it would be the better part of valor for people to wait. Now, I also understand that there's a lot of economic disruption. A lot of people are hurting. They can't pay their rent. They can't buy food for their families in some cases. They're losing their jobs. And so these are real issues that I think we really need to address. But going back to work earlier than we should, and exposing more people to the virus, I don't think is the way to do that.
And any guesstimate from a medical perspective of how a pandemic spreads and how it is ultimately halted or stopped? Any expectation on your end when we might be out of this?
I don't think anybody can say, because we don't really know what the denominator of people that are affected is.
Right.
Early on, it seemed like it was more lethal than it turned out to be, because only the people who were sickest were the ones getting tested. So it looked like it was 3 or 4, 30 times more likely to cause the person to get sick from the coronavirus flu than from a more traditional flu. Mm-hmm. It turns out that may not be. The good news is that may be a distorted figure, because the only people that were being tested initially were the ones who were the sickest. We still need to have a better sense of what is the denominator. How many people out there are infected but don't have symptoms? Mm-hmm. That's an important issue, because those are the people who ultimately are going to provide the what's called the herd immunity. This is what causes, the traditional SARS virus or the other kinds of flus to burn themselves out over time. As more and more people get infected, some have severe cases, most have subclinical cases. That immunity then gets spread among other people, and so eventually the population is at much lower risk. But we're not at that point yet.
Mm-hmm. I'm wondering if in the medical community, you obviously have been on the forefront of bringing plant-based lifestyle to the medical world. Are your colleagues, other doctors, making a connection between eating meat and the pandemic that we're in right now, or eating meat or not eating meat and having a stronger immune system? I'll say meat and dairy here. Are your colleagues starting to make that connection? Again, you've been on the forefront.
Well, unfortunately, most of the efforts have been on avoiding the virus rather than how we can boost our immune system to be more likely to avoid getting sick if we're exposed to it. And I think both are important. But most of the effort has gone in the former, and I think we need to put more emphasis on the latter: what we eat, how we respond to stress, how much exercise we get, how much love and support we have, how much sleep we get, whether or not we smoke cigarettes. Each of these are important factors that we do have control over. Mm-hmm. And I think that's important, because it's so easy to feel like, oh my God, what can I do? I'm a victim, I'm powerless. And we're not powerless. It doesn't mean that you can go out in the world and your immune system is so great that you don't need to worry about it. We need to avoid the virus, but it can't always be completely avoided. And so we need to also do these measures that can enhance our immune function. But what's good for your immune system is good for your heart, it's good for your diabetes, it's good for your you're looking younger. It's good for just about most of the chronic diseases. I really think are just the same disease manifesting and masquerading in different forms because they all share the same underlying biological mechanisms. Things like not only your immune function, but chronic inflammation, oxidative stress, changes in the microbiome, and telomeres, and gene expression, and angiogenesis, and so on. And each one of these biological mechanisms is directly influenced, just like our immune function is, by eat well, move more, stress less, and love more. So it's not that you only want to make these changes because of this pandemic that's out there. These are changes that are worth making because the other pandemic that's out there is heart disease and diabetes. 80 million people in this country have high blood pressure. 60 million are taking cholesterol-lowering drugs. More people die of heart disease than anything else, and yet it's almost completely preventable if we put into practice what we already know. But the good news is that the same lifestyle changes that can help prevent or even reverse heart disease and diabetes and prostate cancer and other conditions are the same ones that can help boost your immune system to help ward off the coronavirus as well.
Yes, I love that you say this. I've had on this show Dr. Kim Williams, who's the past president of the American College of Cardiology and the current president of Rush Medical Center, or the current chief cardiologist at Rush Medical Center. And he says that to varying degrees, 97% of Americans are heart unhealthy. So you imagine that when you start to overwhelm Medicare with something like that kind of figure, it just becomes untenable. And through what you're saying, which I love, it's so empowering for people. You don't have to stand in line. You don't have to go to the doctor. You don't have to hope that very expensive pills will maybe, as we guess, fix your situation. You can actually fix your situation right here, right now, today. That power is right on your plate, and it does so many things. It fixes your health, but it also sends a direct message to where you want your dollars to go. So it's very empowering to be plant-based. You're just checking off lots of boxes, one plate at a time.
Yeah, I don't want to give people the false sense that if they eat a plant-based diet, then they can go out and be exposed to the coronavirus and their immune system will protect them. That would be foolish. But no matter how hard we try to avoid the virus, invariably there are times we may get exposed unwittingly. And how our bodies interact with that is something that we do have more control over than we once thought. Dr. Williams first found that he had high cholesterol levels a few years ago when he was the president of the American College of Cardiology. Didn't want to go on a lifetime of statins, did some research in the literature, came across our work, went on my program just from reading one of my books, and his cholesterol came down by over 50%. And then when they had their annual scientific sessions, we gave a session on lifestyle medicine there. Medicare is now covering my program for reversing heart disease in hospitals and clinics and physician groups around the country. If your listeners or viewers here go to ornish.com, it lists all the various sites that we've trained. We're trying to make this available to people who can least afford it. Many of the major insurance companies are covering it now as well. And so having seen what a powerful difference these changes can make, I wanted it to be economically affordable for people who most need it. But even if you don't go through one of our programs, these are really, it doesn't cost anything to love more, to walk, to meditate. And this is actually a third world diet. It's really the way people were eating before they could afford to buy all the meats and fatty foods and so on that can often lead to these chronic diseases and can suppress our immune function.
Yes, so I want to give people that website again, Ornish, ORNISH.com. But you said something really quickly there, which is actually a very big deal. In 2010, Medicare began to reimburse costs for Ornish's program for reversing heart disease and a program of intensive cardiac rehabilitation. So I would love to hear your perspective on changing the business model of the healthcare system, because currently it's really set up to promote sickness. It's not set up to promote health. And I'm wondering if you see that system changing.
It is changing slowly, but it's not as fast as I would like. It's really a sick care system for the most part than a healthcare system. But when you learn that 86% of the $3.6 trillion that we spent last year in the United States on healthcare are for treating chronic diseases that are often preventable and even reversible through simply making lifestyle changes at a fraction of the cost, and the only side effects are good ones, we realize that there's an opportunity here. Heart disease kills more people than virtually everything else combined, and yet it's almost completely preventable for just about everyone today if people made big enough changes in lifestyle. The same is true for type 2 diabetes and other conditions like that. The reason that I spent 16 years to work with CMS to get Medicare to create a new benefit category to provide reimbursement for our lifestyle medicine program for reversing heart disease is that we're trained to use drugs in surgery. We're reimbursed to use drugs in surgery as doctors, and so that's what we tend to do. I'm on the American College of Cardiology's subcommittee on nutrition, and we published a paper last year. We found the average doctor gets 4 hours a year of nutrition training, and the average cardiology fellow in their fellowships, in their 4 years of fellowships, gets none, gets zero. And so I think if we could reimburse this, it'll change not only medical practice but even medical education, and that's what's been happening. It's not happening as fast as I would like, but it is finally happening, and that's encouraging to me.
And are you getting any pushback from either the system as a whole or your colleagues that haven't made that switch over to lifestyle medicine, let's say, and feel that this is a threat to their business model?
No, they're seeing this as an opportunity because Medicare and many insurance companies are now reimbursing this at a high enough level that it can actually provide additional income for them. And they're not able to do the stents and angioplasties that they've been doing before because over 8 randomized trials have shown that in stable patients, they don't really work very well. They don't prolong life, they don't prevent heart attacks, they don't even reduce angina in most people. And yet the lifestyle changes can do all of those things in just a matter of weeks. And so I think there's a convergence of forces that make this the right idea at the right time. On the one hand, the limitations and costs of drugs and surgery are becoming increasingly clear. There are 2 randomized trials, 10-year trials of men with early stage prostate cancer. Only about 1 out of 50 men actually benefits from changing from surgery or radiation. The other 49 often end up impotent or incontinent or both. In the case of stents and angioplasties, we've talked about that. In the case of type 2 diabetes, getting your blood sugar down with drugs doesn't work nearly as well as getting it down with lifestyle in terms of preventing the horrible complications of type 2 diabetes, the kidney failure and heart attacks and strokes and amputations and impotence and so on. But getting it down with lifestyle, you can prevent all of those. And so I think there's a growing awareness that I think our unique contribution has been to use these very high-tech, expensive, state-of-the-art scientific measures to prove how powerful these very simple and low-tech and low-cost interventions can be. Now, drugs and surgery used properly can be life-saving. We've all benefited from that. But they don't really treat the underlying cause of why we get chronic diseases. It's a little like mopping up the floor around the sink that's overflowing, but nobody's turning off the faucet. And the faucet or the cause are really the lifestyle choices that we make each day. And when we make different ones, what I'm continually impressed by is our bodies often have a remarkable capacity to begin healing, and much more quickly than I had once realized, if we can treat the cause.
Yeah, there's a couple important things that you say here. First of all, groundbreaking work on your behalf, working 16 years to finally get this new category that can be reimbursed by insurance. That really is a game changer. The body is trying to help you out. It's amazing how it does come back. Sometimes even after decades of abuse, it is still there to help you out. It is truly a miracle and a wonder. But I'm also encouraged to see that your colleagues aren't really fighting you on this. So that's good to think that maybe there's going to be a shift in how we healthcare in the future, because
I'll tell you a story about that. When I was a medical student in Houston back in 1977, 78, I was learning how to do bypass surgery with Dr. Michael DeBakey, a surgeon who really pretty much invented the procedure. And he said, "What year are you, son?" I said, "I'm starting my 3rd year of medical school." He goes, "Damn, it's going to be so much harder to bust you out of here now with these weird ideas you have." And then about 3 years ago, after not hearing from him for decades, I get this call and says, "Hey, Dean, this is Mike DeBakey." He had a very distinctive Louisiana accent, and I recognized it immediately. I said, "Well, thank you for this call. To what do I owe this honor?" He said, "Well, you know those ideas that I gave you such a hard time about when you were a medical student years ago?" I said, "Oh yeah, I remember very well." He said, "That's what kept me alive all these years." And he was 99 years old, and he said he died a few months later. And he said, "I just wanted to let you know that before I passed." So, if you have a longer event horizon, change can come slowly, but it does come. And I think that the time is really right because there's this convergence of forces that finally make this the right idea at the right time.
And it's an equal opportunity cure. So rice and beans, some of the least expensive food on the planet. Sometimes it's difficult, depending on people's socioeconomic status, to get front in line for stents and the rest of it. But here you have this really affordable, accessible to everyone healthcare option, and that is a whole foods, plant-based diet with some exercise, low stress, and hopefully a good relationship and support system. We are just about out of time, so I have a couple quick questions. First of all, everybody, Jay Ornish, ORNISH.com, and his book, Undo It, to review all of this information that we've talked about here today. Also, please, doctor, keep us updated on Alzheimer's. I see this as something cropping into society more and more, almost the new cancer, if you were. That would be devastating, of course. So if there were to be a cure, particularly through diet, which is so accessible to all for Alzheimer's, I'd love to hear more about that. So
we're still recruiting patients for the study. So if you live in the greater San Francisco Bay Area, just go to Ornish.com. There's a page there on how to let us know that you're interested in learning more about it. Everything that we provide, including 21 meals a week, is free to you.
Wonderful. Oh my gosh. So if you are in the San Francisco area and want to be a part of this study, Ornish.com. A couple of exit questions. These are meant to be one word or one sentence answers, just kind of rapid fire things that come off the top of your head. What are your predictions for the future? That can be the medical community or just the community at large.
Well, that's more than a one sentence answer.
Fair enough.
In our lightning round here. I think in the short run, the medical community is focusing on the coronavirus because it's so overwhelming. But I'm hoping that it doesn't cause us to neglect, chronic diseases that in many ways are responsible for many more deaths every year. They just don't happen infectiously, although, some people call it a foodborne illness. It's not quite the same. But over time, I think there is a growing awareness of the importance of lifestyle medicine. I'm known as the father of lifestyle medicine because of the 42 years of work we've done showing what a powerful approach this can be. Lifestyle medicine is using lifestyle changes not only to help prevent disease, but often to treat it and even reverse it, either in combination with drugs and surgery or often as an alternative to them. And I think this is a wave that hasn't even begun to crest yet.
Mm-hmm. It's such a very exciting time. As I said at the beginning of this show, it's the beginning of the social justice movement of our time, the business innovation movement of our time, and the healthcare reform movement of our time. What do you wish you knew 10 years ago that you know now?
Wow, that's a good question. I'd have to give that some thought.
I will circle back with you for interview 2. Don't get away from me. Okay, if you have a bad day, and of course, many of us have been having a string of them lately, is there a phrase that you say to pick your spirits back up? Something that you say to sort of get your mind in the right space again?
Well, this too shall pass. And I think that we have a lot more choice on how we react to things than we once realized. I have a cartoon I used to show years ago when I give a lecture of a father and a son in a car, and they're waiting at a train crossing while the train goes by, and the father goes, damn it, this train, I'm all stressed out, why do I have to wait? And the son goes, Daddy, we get to watch this train go by. It's the same event. One is pleasurable, the other is really stressful. We have a lot more control over how we view things than we had once realized. And so I think that when we're under these stresses, to realize, well, I could react in this way. I know where this goes. It's not going to be really helpful for me or the people around me. But I have another choice. I could actually do it this way instead. And when people realize that, I'll give you an example. My wife and I have been together for almost 20 years now, and we're totally committed to each other. So if we have a misunderstanding, we can both get locked into I'm right, no, I'm right, But if you're totally committed to someone, then sooner or later you're going to get to a good place. So we realize, well, why don't we just skip all that other stuff in the middle and go right to that place, and just learn whatever lesson there is and not get stuck in who's right or wrong. Because if I'm right, then you have to be wrong, and that's not going to make me happy either. Let's just see what we can learn from this, let it go, and go back to those good places and those good feelings. And as you get older, every day becomes precious. Or through the midst of a coronavirus pandemic, every day becomes precious. So why wouldn't we want to use them in the most fun and productive and healthy ways, as opposed to getting stuck in suffering that we can often avoid?
Yes, I love that. Words of wisdom. See what we can learn from this and basically move on. I love that. Do you cook?
I cook, but not so well.
Okay, fair enough. So a couple of quickie questions. What are we always going to find in your fridge?
You're always going to find fruits and vegetables and whole grains and legumes and probably some soy milk and some chocolate.
Ooh, okay. Dark chocolate?
Dark chocolate.
Dark chocolate.
Really good quality dark chocolate.
And you say that you don't really cook, but is there one kind of go-to meal that you can put together yourself that's always good, that takes 10 minutes that you rely on?
Just to chop up some vegetables, put them in the steamer, some organic vegetables. You don't really, if they're organic and they're, you don't really have to do anything to them. People are like, oh, broccoli, that's it. And they don't realize you just take some broccoli florets, put them in a steamer for 10 minutes or so. It's absolutely delicious. Put up some other, some tofu or some, whatever it is, some beans, some rice, some, whatever your favorite foods are that are plant-based. It doesn't take very long to make, and it's delicious and nutritious.
This is one of my favorite things. I call it a garbage bowl. I see whatever is about to go bad. So if I've got, half of an avocado left over, some, carrots and broccoli, whatever's just hanging around, and I throw it over brown rice and some sriracha or some Tabasco, and I'm good to go. My last question for you, sir. It's been a very busy day. You've seen a gazillion patients. You didn't have time for lunch. What is your go-to snack?
My go-to snack is dark chocolate.
Dark chocolate. I see we're doubling down on dark chocolate.
Well, if you really, in small quantities, it can dilate your blood vessels. It has a lot of flavonols and a lot of good things that are actually healing. And if you get really high quality dark chocolate and close your eyes and meditate on it, a single piece can be in your mouth for 2 or 3 minutes, and you can just savor all the different flavors, make it a form of meditation. Then you get tremendous pleasure with very few calories.
You heard it here first, chocolate as medication. No argument for me. Dr. Dean Ornish, father of lifestyle medicine and author of Undo It, which everyone can get on Amazon.com. And of course, if you want more information, go to ornish.com, ORNISH.com. Thank you for spending time with me. And really, thank you for all that you have done for people's health. You alone, sir, move the needle, and I am grateful.
Thank you. Back at you, and thank you so much.
Everybody, we will be here every day, 1 p.m. during coronavirus times. It's the Plant-Based Business Hour with Elizabeth Alfano, an awesome vegan series. Doctor, I hope you'll be back.
Thank you. I'd like that.
Tomorrow. Bye.
Thank you. All the best. Thank you.